Hello, everyone. Welcome back to the Social Impact Solutions podcast. This is part 3 of a 3-part series of how to get started with impact measurement. In the first part of the series, we talked about theory of change and logic models. In part 2, we discussed how to set measurable goals and objectives. And in part 3, we are discussing consistently capturing reliable impact data. For those of you who are listening to audio, all of the visuals are available on YouTube. And for those of you who are on YouTube who would like to go for a jog, go for a bike ride, or just do this while you work somewhere else, this is available on Apple and Spotify, the Social Impact Solutions podcast. And I'm here with Lauren, and we're excited to get into our favorite subject on how to capture reliable impact data. Lauren, you want to go ahead and kick us off?
Wonderful. Thank you, everyone, for being here today. John Mark, thanks so much for the introduction. And we're really excited to talk today about part 3 of our impact measurement series and how to get started. Again, if you have listened to series or part 1 and 2 of the series, you know that this stems from a recent webinar that we did and feedback that we've received. And we're just wanting to help as many nonprofits as possible right now, as a lot of organizations are scrambling and concerned about funding cuts and what this is going to look like over the next few weeks and the next few months. So we took 3 topics that we felt like were most important based on surveys that we have sent out to nonprofit leaders and real-time feedback that we're getting from partners, clients, and others in the industry. So we've talked about theory of change in part 1. We've talked about measurable goals and objectives in part 2. And today we're really excited about talking about how do you put all this together and how do you measure impact consistently and over the long term. So with that being said, would love to hit some of the high points of capturing reliable impact data and how this will help you over the long term. So if you don't have impact data, if you don't know your outputs, if you don't know your outcomes, measuring your impact will absolutely help you determine outputs and outcomes, something that it's critical. It's required by most funders at this point, not just grants, not just foundations, but individual donors, corporate partners, and other stakeholders too. When you have these metrics, you can calculate dollar per output and dollar per outcome, which can be really beneficial and informative for your internal team as well as external stakeholders. This will help you measure progress over time. It will help you report your progress on a monthly, quarterly, or annual basis. And most importantly, you'll be able to see results in real time and make adjustments.
Right.
So rather than, just looking at results on a quarterly basis or an annual basis, and then making changes, 3 months, 6 months after you've reviewed those results, if you have this in a good digital dashboard, if you have all of your data captured somewhere that it can be pretty quickly and readily analyzed, having these quicker feedback loops makes it so much more effective for your organization. And I think this is really critical right now. I think we saw this with COVID. So when any major unexpected events occur and there's really big change and you say, oh my, what are we going to do? How are we going to make this work? How are we going to pivot? Having good, reliable, real-time data can help you make such better informed decisions. And again, we saw nonprofits do that with COVID, and they were able to pivot. They were able to keep their critical programs that were having the biggest impact. And maybe they pushed pause on those other programs that weren't creating as much good or as much change. And same thing right now. If you don't know that you're going to continue to receive funding, or if you're already experiencing funding pauses or funding cuts, and you're worried about what this is going to do for you long term, having these insights can be critically important at any point when things are normal, but it's even more helpful when things are abnormal and there are some critical changes occurring. So John Mark, would love to hear your insights and your feedback on that as well.
Yeah, I think it's a really, really good point. It's like what Lauren referred to with COVID. And then Lauren was having a conversation with someone else who was doing impact measurement during the 2008 financial crisis. And her feedback was exactly the same.
Right.
It's when times become more competitive that the organizations that measure and market their social impact stand out even more than in non-competitive times.
Yeah.
We've always known that the better you measure and communicate your impact, the much higher likelihood you have to raise substantial funding so you can scale your programs. But it's absolutely true when times are more competitive because you just stand out even more as grantors and funders of all types start to evaluate how they're allocating their donations. And so it's important to think about it that way. I think it's really fun though to sort of break down impact measurement. This is feedback that we get all of the time. So many folks tell us, I didn't really understand what impact was until I started sitting in on some of these webinars or started working with social impact solutions. And we just want to make that widely available. This is one of our biggest frustrations or opportunities, if you want to frame it positively, is that there's not a lot of great resources out there for nonprofit leaders when it comes to measuring impact, right? It's something that is sort of mystical or very fluffy. And we love to take a rigorous approach to, and a very just simple and effective approach to impact measurement. And what we said on a previous conversation in the series, in episode 2 of this series, we're trying to measure change over time through your programs. So, regardless of what kind of program your nonprofit has or programs your nonprofit have, you're trying to look at the change that you're creating for the people or cause that you serve over time. And one of the most effective ways to do that is to actually measure that change on an ongoing basis, not intermittently, not manually. It's great to do it digitally. And Lauren, I love the analogy that you have here for thinking of impact measurement, ongoing impact measurement, the same way people can think about a heart rate monitor.
Yeah, I actually think you're the one that came up with this analogy, John Mark, and I was like, that's really great, or at least I think it's great. That just like all of us that are here, you, John Mark, myself, and anyone that's listening or viewing this video, we all have a heart rate, obviously, clearly, and that's a good thing. But how many of you have a heart rate monitor or a watch that measures your heart rate? A lot of us do, especially now that smartwatches are so common and prevalent, but you might not ever look at those results. So whether you're measuring and tracking your heart rate or not, you still have a heartbeat. And we like to make this analogy with impact. Whether you're measuring and tracking your nonprofit's impact or your program's impact, whether you're measuring or tracking that or not, you're still creating an impact. You just don't know what it is. You don't know how big it is. You don't know if it's positive, neutral, or negative.
Right.
And with any organization that we've worked with, overwhelmingly the impact is positive. Inevitably, you are going to have some neutral and negative components too. And that's okay. They're not a failure. You don't have to be overly concerned about that. It's just information that helps you understand, okay, what can we cut? What can we change? How can we improve? And where can we expand what is already working really well? But back to the heart rate analogy, we can manually take our heart rate, and sometimes that works just fine. If you're worried about heat stroke, or if you're worried about some type of health concern and your heart rate's really high or maybe really low, you can manually take your heart rate. You can just take it at your neck, your wrist, your ankles. There are multiple places where you can get a good pulse, but none of us have the time, the mental span and attention to just constantly be manually, walking around like this with my, pointer finger and, here and taking my heart rate. No one is doing that all the time on a continuous basis. And so taking your heart rate manually, I like to make the analogy that that's the equivalent of randomly, sporadically distributing paper surveys. It will give you some information. You might be able to use that information or report it to some degree, but there's not consistency, and it's not super reliable. It's intermittent, and oftentimes you're going to forget what your heart rate was if you don't write it down. And it's not going to be helpful unless you're keeping a log and reporting that back to your doctor or whomever needs that information.
It's a very good way to do it.
Right, exactly. So we also have watches. You might be able to get a cheap, maybe a $10 or $50 watch that could track your heart rate. but it might not be super reliable. Then we might have $100 or a more expensive watch like an Apple Watch, a Garmin, something like that, that is going to be a lot more reliable. It's going to give you more data than maybe you care to look at, but it's reliable and it's much more consistent. I have a Garmin watch. John Mark has a good athletic watch, and they both have apps associated with them that we can go back to, and I could see what my average heart rate was 2 weeks ago, 2 months ago, 2 years ago. And then we have more sophisticated armbands or chest bands if you're wanting to really measure your heart rate more consistently and more accurately during workouts. And then, sort of the highest level would be a hospital bedside monitor. And not very many people are walking around with those either, unless, there's a crisis or a reason for that. And so this is just an analogy of different systems or levels that you might choose within your organization. And we would like to advocate for somewhere in the middle. Typically, don't do the manual. Please use as few paper surveys as possible, and hopefully things aren't critical to where you're needing that hospital bedside monitor either. But the 3 options in the middle would be where we would advocate for people to start and then grow from there.
Yeah, that was so well put. And it's just, since we got to this slide, I turned my heart rate monitor on. I've got a Suunto watch, and it fluctuated between 52 and 64, right? That's what it's just going back and forth, back and forth. And that's probably somewhat accurate given the fact that I'm sitting down right now. But I've gone on runs where I just track my heart rate on my wristwatch, and it's wildly inaccurate, right? Wildly off. 20, 30, 40 beats per minute off. And so you look at, it's a good watch. It's not a crazy expensive watch, but it's a good watch. And that next level up is that chest band, right? That you have to then sync. It's Bluetooth enabled with the watch. But it's so much more accurate because the only job that chest band has is to measure your heart rate, right? It's not tracking GPS, it's not tracking anything else.
Mm-hmm.
And so you think about this analogy that Lauren just, wonderfully put out here, is that the manual paper surveys are the least convenient and the least helpful. It's also the least expensive, right? And so it's really, really easy to print out a bunch of surveys. It's very inexpensive to print out a bunch of surveys and then distribute them. But what typically happens? Nothing ever happens with it. It just collects dust in a cup or in a, somewhere, in an office somewhere in some part of the world, depending on what you do. And maybe once a year you have an intern. It's like, what are we going to give you? What job can we give you? Oh, why don't you put all of these paper surveys into an Excel doc for us? Do a spreadsheet for us. And then what happens with that? Typically nothing, right? And so it's months old or a year old piece of data that's no longer relevant. Whereas with that $10 watch, $100 watch, or the chest band, you have immediate access to that information. And while some of it may or may not be terribly accurate, some will be more accurate than others, at least you have something because it will be directionally true. It might not be precisely true. So I think it's a very useful way of looking at technology to make impact measurement really easy because I sleep with my watch on. It's tracking what my heart rate is at night. But there are more accurate things out there that can track sleep than my watch can. But I'm okay with this alternative. I don't need to spend however much money on an Oura Ring to know, what my heart rate is currently. Personally, it's a great fit for other people. It's just not something that's as huge of a deal for me. Lauren, is there anything else you wanted to say on that?
Yeah, I think you mentioned that paper surveys, they're cheaper, they might feel easier, and this is true. But I think you have to realize the cost of making it cheaper and easier on the front end.
Right.
Does not mean that it's cheaper, easier on the back end. It's typically going to actually be more costly, like you mentioned. Paper surveys get lost all the time.
Mm-hmm.
I don't know how many times you and I have experienced that over our last, 10, 15 years of dealing with nonprofit program data.
Right.
We've seen piles and piles of paper surveys in the States and internationally that they're never used
Right.
because there's just no one, they don't have the personnel or even the systems to input that data into something, whether it's an Excel file or something more robust. And so just making it quick and easy and reactionary on the front end does not lead to good results in the long run. So taking, what might feel like a little bit of a learning curve if you're implementing a new software system, what might feel like a little bit of a budget stretch on the front end, just think about what that's going to do for you in the long run or even in the short term. So how much time is that going to save your team? How many people is that going to prevent you from having to hire? How much time is that going to save you? And ultimately, it's going to give you such better data that you're going to be able to get grants, individual donors, partners, volunteers, board members. You're going to be able to have so much more valuable and reliable data. So just think about these things and don't just do the quick, cheap, easy option just because, that's what makes sense for right now. Give it a little bit more long-term thought.
So well said. So well said. And just thinking back to your point, I know we've said this 100 times, but the primary reason why a funder gives is to make a social impact. So the easier you make it to measure and report on that impact, the easier fundraising is going to be. And so just like how, you might think it's cheaper to print out a bunch of surveys. Well, it's only the cost of paper. There's a cost of inaction, right? There's a cost of not reporting on that impact. And so that $10 watch is substantially more useful than those paper surveys. So I love the way that you said that. On this side, this slide, we want to talk about different ways to capture impact data. You got to think like this data, it all has to live somewhere. And the phrase that's often used is just database. And so it all has to be housed in some form or fashion. Some people have, a Google Sheets empire where all of this information lives. That's your $10 heart rate monitor, right? Your $10 watch.
Yeah.
But there's different levels, right? There's different levels to this impact measurement spectrum. And so there are constituent management databases. So like think of a CRM, but just for the people that you serve. There's software that can just collect data. So most people have heard of SurveyMonkey. It is a way of capturing survey information, but then that has to live somewhere as well. There's Kobo Toolbox, which is, I'm pretty sure it's a free platform. Isn't that right, Lauren?
They have a lot of free features, yes. And then I feel like almost every time I look at their website, they have something new or,
Great.
they've added and expanded. So they're really fantastic. They do have free features for nonprofits, and then they have paid options as well for both quantitative and qualitative data. So not everything is free, but they do have free options.
And they're fantastic because they work offline. And so for anyone that's working in an offline environment, Kobo Toolbox is
Yep.
fantastic.
Yep.
SurveyMonkey sort of has an offline thing, but we've used it a bunch of times. It's not, I wouldn't recommend it. I think there's better alternatives than to using, because you still have to get the enterprise plan, blah, blah, blah. We don't need to get down that road right now.
No, I think SurveyMonkey can be great online and offline, but some of their offline features it can get more expensive. But I do think it's still a good option.
It's a great platform. There's no way around that. Other options that you're looking at, Sure Impact is a great software. SoPact is more of just like an analytics platform that you would bake into your Salesforce. Also a good platform when you're looking at creating impact dashboards and things of that nature. Salesforce obviously is going to be one of the most robust databases that you can dive into. And then the associated Tableau with Salesforce. But Lauren, is there anything that you want to talk about with these different platforms?
No, I think that these are all really good options, and there are others out there too. These are just some of the ones that we come across with the most frequently or that we use with our clients the most often. For healthcare systems, obviously Epic and MyChart have a lot of data, HIPAA compliance and de-identifying data can be a concern there. So there are lots of other options. There are customizable apps and things of that nature, but these are just some starting points to look at. We didn't put Google Sheets on here or Google Suite. If you really are massively limited budget-wise, those can, they're still better than paper options. And you can connect Google Forms to Google Spreadsheets and make it work. I wouldn't say that it's the best option, but it can work. So
Right. Where we spend most of our time, we love technology, right? We love technology, but we're not a tech company. That's not our bread and butter. We design systems for nonprofits to implement and execute data capture and reporting on an ongoing basis. Because tech companies do a great job of building technology, but they typically run into an issue with, oh, adoption's the main problem, right? And so that's where we come in. We come in by helping people connect the systems, but more so designing the systems and the programs appropriately. Lauren has a doctorate in public health, a master's in nutrition. There's lots of data and research and just experience that it requires in order to be able to build out a program, but build on a program evaluation and an impact data capture process at the same time. So we're pretty software agnostic, to use their term. We like a lot of different softwares. We love low code. We love Salesforce. So we're fans of all of it. It just matters what's most appropriate for your context and your nonprofit. And we don't have a huge bias as to which one you use. We would just be thrilled that you're using one. But understanding that you can outgrow these softwares, and that is perfectly fine. There's nothing wrong with that. That is as normal as the day is long to outgrow a system. And so just understanding that nonprofits have more resources available than they ever have. I mean, we cut our teeth building out some of these platforms for nonprofits that we worked with many years ago in offline environments in different parts of the world. And it has gotten so much easier. Now, it was just really hard before, and it's so much easier to capture, collect, and report on meaningful impact data.
Right. And I think that's probably our next slide, is just talking about, you know, what works well and what works with your existing operations, your existing processes, the existing flow of your
Right.
programs. We'll talk about in one of the next upcoming slides. And so, yeah, you don't have to choose Salesforce because it's the biggest and the best. If that already makes sense for your organization,
Right.
that's great.
Right.
But, depending on your size, depending on how many data points you're even capturing or how many people you're serving, absolutely depending on budget. And do you even have an IT department? So lots of things to consider, and being as practical as you can and evolving as you need to is absolutely normal and advocated for.
Absolutely. Absolutely. I think this is a great slide to camp out on for a little bit. So, Lauren, if you want to talk about knowing what data to capture, what is most important for you to capture as an organization?
Yes. So once you determine what system you're going to use, and maybe you're looking at this at the same time,
Mm-hmm.
maybe you're looking at, well, what are we going to capture? And that's going to inform what system or software we choose to use. That's perfectly fine as well. But yeah, this is something that we help organizations with all the time, is determining what they actually need to capture. So, going back to the logic model that we talked about in part 1 of this series, going back to measurable goals and objectives that we talked about in part 2 of this series, should really inform the data that you need or want to capture. So, looking at your logic model and seeing, okay, well, what are we hoping for? What outcomes are we trying to reach? Or maybe what outcomes have we already reached? What long-term impacts are we aiming for over the next 3 to 5 years? What are our outputs? Looking at all of this information should help you determine the data points that matter most to your organization and to your programs. We talked about this in the second part of this series, but we'll mention it again here. Finding existing validated assessment tools is a really important piece. So we see organizations that often create their own surveys or their own assessment tools. And oftentimes it's with good intention, but what usually happens is these questions are very much geared toward what your program director or people inside of your organization want to see. And it doesn't necessarily give you data that is overwhelmingly compelling or even reliable when you're reporting that information to external stakeholders. So choosing a validated assessment tool is another great way to decide some of the data points that you want to capture. So obviously looking at your own goals and objectives is a key place to start, but then looking at, we have some examples on the screen here if you're watching this on YouTube. If you're listening to the podcast, I'll just read them out. But we have a comprehensive diabetes assessment from Johns Hopkins University that's available. It's free to the public. You could use that assessment if you have a diabetes prevention program. We have a health survey for homeless populations by the University of Chicago. And then a third example here is advocacy effectiveness analysis by the Casey Foundation. So we use a lot of tools from the CDC, from the World Health Organization, and others that are validated assessment tools, meaning that they have been researched, they have been validated by third parties, they have been piloted and iterated, and so they are very reliable. They give you good, valid data from multiple populations. You could use it in one place and use it in another and get good data depending on, or despite changes in geography or demographics. And so this just gives you better data and better insights and reduces a lot of bias in comparison to creating your own surveys.
Yeah. And I remember you saying this a number of years ago. You're talking about there are so many academics and so many academic institutions that have dedicated millions of dollars and years of their life to validating an assessment tool. Mm-hmm. Going through the process of saying, hey, is this an actual useful, whether it's a survey, so this SF12 health survey for the homeless population, is this a valid tool to judge whether or not this intervention is working? I mean, these are very smart people who dedicate their entire careers to getting a survey validated, meaning it is a legitimate, it's gone through a peer-reviewed process, it's got rigorous study that's gone along with it. Yeah. It's not just a couple people around a table who says, hey, let's ask a few survey questions. And I'm not trying to be, cute with that. It's just people put a lot of work into these, and it's a shame that we don't lean into it more often, because there's a lot of really, really great information that the academic community has shared with everyone else to be able to know what's working and what's not working. And I think it's just helpful to know what is at your availability. And that's a main mission that we have at Social Impact Solutions, providing valid resources, helpful tools to help you measure and market your social impact so that you can raise more money and do more good. And one of the ways that we'd love to help you, if you have more questions, if you want to learn more, is that we have a fundraising quiz. And this fundraising quiz will ask you questions based on social impact, because it's the primary reason why donors give to your nonprofit. I'd say the most helpful piece of fundraising advice is the impact that your nonprofit creates. It also is going to ask you questions about your fundraising strategy and your marketing strategy and your communication strategy, so that all of these energies and efforts can be aligned. And what you want is an aligned nonprofit strategy. There's a lot of disjointed nonprofit strategies that are in play right now. And it doesn't take 5 years to right the ship, right? It shouldn't take 5 years to do that, although that is very normal. Getting started with this fundraising quiz that you can just scan this QR code or go to fundraisingquiz.org to access this is a very quick, easy, and completely free way to get a very useful result. It only takes you about 3.5 minutes to complete the quiz. And you're going to receive training videos, all sorts of bonus features. And when you take this quiz, I think it'll be really helpful for you.
Great. This has been a great conversation. Thanks so much, John Mark. And we're excited in the next few weeks to do a webinar and a follow-on podcast series that are more focused on the impact communication side of things. So this series has been a lot more on capturing and measuring impact metrics. And we've had a lot of feedback, a lot of questions about, okay, then how do I take that and report it and communicate it to stakeholders? So stay tuned for that conversation in the next few weeks. And thanks so much for listening.
Thank you so much. Appreciate the work that you do. And thanks for being here today.